Did you need something? Okay. Well, I will. Let us talk for a second, please. Are you ready? Okay. All right. Good afternoon, everyone. Thank you all for being here. We're here today in the Back of the Yards neighborhood as part of our Protect Chicago Plus initiative. And what we've been doing since we launched this several weeks back is really going deep into neighborhoods that have been the hardest hit by COVID-19. Our Chicago Department of Public Health devised a COVID vulnerability index that identified those neighborhoods across Chicago that really needed extra support because of how they have been really devastated by COVID infections and COVID deaths. And Back of the Yards is one of those neighborhoods. I'm grateful for Mr. Matanke for donating the space, for U of I Health, and for Mile Square, who are really administering the vaccine. As you can see from the line behind us, there's no shortage of people who understand the importance of getting this life-saving vaccine. But even beyond that, we're going to be going out into the neighborhoods, door to door, to get as many people registered as possible. Unlike what happened at the very beginning of our vaccine efforts back in December, what we've seen in recent weeks is people recognize the value of this life-saving disease, but the life-saving vaccine, but more importantly, the safety of it. What we've seen is a swell of people who are excited about getting the vaccine in really neighborhoods across the city, but particularly among our Black and brown populations that were more reluctant, and based upon pre-vaccine surveys that we did. Week after week now, I'm happy to continue reporting that we have seen that over 50% of the vaccine that's going into arms are among Black and Latinx Chicagoans. That is a significant, significant accomplishment. And we didn't get here alone. We get here because of trusted community partners, work that we really started a year ago when we started to see the disproportionate impact of COVID-19 on communities of color across Chicago. So I am grateful for the partnership and the work that's been done to get us to this point, but much more to do. And let me end with a note of caution. The vaccine absolutely provides a light at the end of a very long, dark tunnel. There's no question about that. In vaccine clinic after vaccine clinic, you see the level of relief on people's faces when they know that they've gotten exposure to something that will really help protect them, their families, and their neighborhoods. But I'm concerned because we're starting to see a little bit of uptick in our daily cases. And we're seeing that amongst the 18 to 29-year-old cohort, as well as the 30 to 39. So the COVID-19 is still here, folks. It is still real, it is still deadly, and unfortunately it's still sending people to the hospital every single day. So we've got to remain diligent. We've got to continue wearing masks. We've got to make sure that we're continuing to social distance. Yes, the vaccine is life-saving and gives us a measure of hope, but we are only going to be able to open up our city and have even more opportunity to gather as family and as friends if we do the hard work now and continue to make those sacrifices. We don't want to have to take steps back in our reopening. Businesses are coming back to life. People feel a sense of new life. It's the spring, certainly, but it's because of the vaccine. But we will step back and have to close back down if we are not diligent, particularly that 18 to 40-year-old cohort. It's critically important that those folks and everyone remain diligent. And with that, I'll turn it over to Dr. Allison Arwady.
Thank you, Mayor. I'll be very brief. You know, we're here on a beautiful spring day, and I am absolutely loving seeing the hope at these vaccine clinics, seeing all of the partners. Obviously, University of Illinois is the major clinical partner here. We're at Mile Square, really important community health clinic for this neighborhood. And there are so many community-based organizations that have stepped up to partner with this health center to bring vaccine and the news of vaccine to to this neighborhood. It's this kind of focused work that is the heart of our Protect Chicago Plus initiative, and it's what we want to build, not just for vaccine, but for creating a healthier Chicago even past COVID. We've done more than 1 million doses now. Chicago providers have put more than 1 million vaccine doses into arms. We're making huge progress every day. We're doing it efficiently, and we're doing it in a way that promotes equity. So hope is here, spring is here, but as the mayor said, we are not done. Please keep wearing that mask, doing the social distancing, doing the things that have gotten us this far. Progress is great. You're only considered fully vaccinated when you are 2 weeks post your second vaccine, if you are getting the 2 vaccine series. And even now, we've got less than 15% of Chicagoans have gotten both of those doses. So we're not quite ready yet to take off the seatbelt, even while we're getting a little closer to the summer and really wanting to have a good summer. So with that, thanks very much to the partners, and I'll hand it to Dr. Luna for some comments in Spanish.
Gracias, doctora Arwady. Yo soy la doctora Geraldine Luna, directora del Departamento de Salud Pública de Chicago. Y esta tarde estamos aquí celebrando porque nuestros habitantes, especialmente latinos y afroamericanos, fundamentalmente requieren la vacuna para recuperarnos de la pandemia. Okay, here we go. Gracias. Es por eso que lanzamos esta iniciativa, para proteger a Chicago Plus. Esta iniciativa nos impulsa a vacunar a los que más se necesitan, como en esta comunidad Back in the Yards. Nuestros datos de distribución de vacunas reflejan la gran diversidad de nuestra ciudad. 59% de nuestros habitantes son latinos y afroamericanos. Antes de que se lanzase Chicago o Protege a Chicago Plus, a fines de enero, solo 18% de nuestra población de color recibió vacunación porque había una indisposición general. Teníamos dudas, no estábamos seguros si esta vacuna era para nosotros. Pero ahora, viendo el gran cambio, gracias a nuestra gran estrategia de distribución a la equidad, 53% de las primeras vacunas de la semana pasada se fueron a brazos de latinos y afroamericanos. Esto es un gran avance y estamos celebrando este progreso, pero queda trabajo por hacer. Así que nos reunimos hoy para continuar este gran trabajo. Vacúnense, por favor, y gracias.
Sorry, one more.
Hello everyone, my name is Berto Aguayo. I'm the Executive Director of Increase to Peace, and I'm also a lifelong resident of Back of the Yards. I'm really grateful to the City of Chicago and to all the community partners that made this vaccination site possible. And I also want to highlight the need that exists in communities like Back of the Yards to get the vaccine. And the first day when we launched the slots for the vaccination appointments, they were gone within 24 hours. They were gone, right? And now we're hitting the streets, we're going door to door, we're hitting the taco shops, the grocery stores, the laundromats to get people registered for the vaccine. But the message is also simple. We need more vaccines. We need more vaccination sites to ensure that Black and brown communities like ours get vaccinated so we can return to a sense of normal. So to the extent that we're gonna do our part to make sure that we are meeting people where they're at, whether that's going to the grocery store, whether that's going to our neighbors and to our family and friends, we're gonna make sure we do our part. But we also understand that there's such a huge demand that we need more vaccines for our communities, and we also need more vaccination sites wherever we can pop them up. And again, once again, really grateful to all the partners that made this possible. No one organization, no one individual can do it alone, and it takes a collective teamwork effort to make this happen, and that's what I'm really grateful for. Thank you so much.
Good afternoon. I'm Henry Taylor, Chief Executive Officer for the University of Illinois Miles Square Health Center. First, I'd like to thank the Mayor, Your Honor, for her forward-thinking process for ensuring communities of color have access to very needed vaccines throughout the city of Chicago. Miles Square is part of the University of Illinois, is participating with the Chicago Plus Partnership for providing vaccines at 3 different locations. One at the Inglewood location, here at the Back of the Yards location, and soon to come at the Back of the Yards location on the north side of Chicago. But on behalf of the University of Illinois and on behalf of Miles Square, we want to remind our citizens to wear a mask, and get your shot, because the shot is in fact safe. I'd like to bring forward Dr. Lynn, who's going to provide an overview of University of Illinois. Janet Lynn.
Well, good afternoon, everybody. It is my honor to really speak on behalf of University of Illinois Health and Hospital System. It's been a great honor to have been selected as one of our health institutions within Chicago to deliver this vaccine to the most needed people and community members here in Chicago. It really has been a team effort. I want to echo what Berto said as part of Increase the Peace. It is without the assistance, the help, the support, the engagement of our community partners that has made this actually possible. We bring the vaccine, we bring the clinic, but we do not bring the people and the arms. And our intent is to make sure every single vaccine that has been afforded to us gets into the arms of the people in the hardest hit communities. So I thank actually everybody here, especially the mayor, for allowing us this opportunity to really serve our part as part of community in Illinois and Chicago citizens. So thank you.
All right, we have time for very few questions.
Go ahead.
For Dr. Arwady, please.
Step aside there.
I had a question that was raised by one of my colleagues at Injustice Watch. New York City has 24-hour vaccine sites that are doing it at all hours. Their Commissioner of Health says that this is specifically for essential workers to go at a time that's convenient for them. To my knowledge, Chicago doesn't. Is there any plan in Chicago to open up United Center or another site to do it around the clock or anything like that?
So our biggest goal really as we move ahead is getting vaccine supply here. And as vaccine supply increases, we've got a lot of ways that we're planning to reach essential workers. It's been a major focus of us all along. At this point, there's not plans for a 24-hour situation. We've more thought about bringing vaccine in strike team kind of ways at off hours as necessary. We'll see what the demand looks like and we'll see what the vaccine supply looks like. We're always interested in new ideas, but we've been very focused here. And even as we move to 1C in Chicago next Monday, you'll remember that essential workers are part of that group. We felt very strongly about making sure people with underlying conditions and the frontline essential workers who can't stay home, who can't always keep the distance, get prioritized. So we'll keep prioritizing those workers and we'll see if there are more creative things we need to do to reach them. We'll think about those.
And then one for the mayor, actually. Do you have any comment on Alderman King's ordinance or zoning change that he's put forward, suggested for house museums in the city of Chicago?
Well, I think the outcry that you've seen from people all across the city, different neighborhoods, really kind of speaks for itself. I think it's highly problematic. We're more than willing to try to work with her to address the concerns, but I think by completely banning these kind of residential museums, it's an overreach for what the narrow issue is that she's identified. But there's a lot of concern that's been raised about it from all quarters, not the least of which is the arts community. So we've got to address that.
Right, a couple more.
Mayor, the emergency travel order states anyone traveling from a state on the orange list is directed to obtain a negative COVID-19 test result no more than 72 hours prior to arrival in Chicago or quarantine for a 10-day period for the duration of their time in Chicago, whichever is shorter. How's the order being enforced? Is anyone checking the COVID test results paperwork at O'Hare?
Go ahead.
Yeah. So I would add just to that, make sure there's awareness that people who are fully vaccinated 2 weeks post that second vaccine dose are exempt from that quarantine requirement. So all along we've had this travel order in place actually since July, and it's been an effective way first to educate people, to make sure that there's awareness that COVID is not hitting the country in the same way and that there are places that are at significantly higher risk if people travel there than they are here in Chicago. We are not stopping individuals. We are not doing every single person who's traveling. We don't have the capacity to do all of that. But what we do have the capacity to do is first make sure that people have the understanding that if they are traveling, they're traveling to a higher risk potential setting. And if we're identifying anybody of concern for other reason, we are able to ask them to show those results. Our plan here is really consistent with what people are doing all around the country. With variants on the rise, travel remains a significant concern. And so even even though we don't have significant enforcement resources to put into it, it has played a really important role in terms of limiting some of the travel, and our recommendation still is to be limiting non-essential travel.
All right, two more folks.
Hold on. Let me just follow up on that point. You know, what I've also seen is that people are abiding by it. We've seen schools, we've seen other institutions that are educating their members or their populations about what they need to be doing if they're going to travel, what they need to do when they come back. So I do think that the travel order has been effective in really elevating the consciousness of the public around safety when they're traveling to other environments. Yes, right here.
Unfortunately, there's many people eligible under Phase B who still have not been able to either make an appointment or get a vaccine. While it is great to see that now back of the yards, there's new efforts being implemented, what new efforts will you make sure that your team will implement to make sure that our senior citizens especially will be able to get vaccinated?
Well, we've been very focused on seniors from the very beginning of 1B, and we will continue to be focused. We're about 50% of the seniors in Chicago being vaccinated, but we're way behind other jurisdictions. So we've got to keep doing what we've been doing, which is trying to educate, go into communities, talk to, come on up, doctor, I can see you inching forward. Talk to family members to encourage them, as we're seeing at these kinds of clinics, whole families coming together, the adult children taking the seniors. So why we are so focused on Protect Chicago Plus is to make sure that we really do not leave anyone behind, particularly in these neighborhoods that are most vulnerable. Those efforts will continue even as we open up the possibility of vaccine to others.
Dr. Arwady, if I may, how do we make sure that the vaccines are eventually getting here?
Yeah, so one thing just to follow on that is that I really want to make sure everybody is hearing seniors remain the priority, especially this week before we move to 1C. 312-746-4835 is the number anybody 65 plus can call in the city of Chicago. You can live anywhere in Chicago, and we've got folks, more than 200 of them, who are answering the phone and helping seniors get appointments. So I really wanted to get that in. 312-746-4835. In addition, we've worked as the United Center. We continue to add appointments there. We've expanded some of that eligibility with some of the prioritization to some of the other zip codes. Again, working to make sure that some of the less vaccinated areas of the city have the opportunity first. But we do continue to put appointments for the United Center up on ZocDoc every day as well.
We want to talk for a second. We're going to talk for a second about CFD going to postpone. That's okay. All right, go ahead. Wait, I just want Dr. Arwady to add.
Yeah, just adding, one of the other things that we've been working to do here is bring vaccine with Chicago Fire Department to people who are unable to leave their home, this Homebound program. We've had a lot of interest in that. I want to reinforce it's not the fastest way to get a vaccine, but when you don't have another option, making sure you can go to chi.gov/covidvax, sign up there, and we're working to scale that program up some more so that really we want everybody who wants a vaccine and needs a vaccine in Chicago to be able to get it, especially as vaccine supply ramps up in April and May.
I just have one for Dr. Arwady and then one for you, Mayor. Talk a little bit latest on supply. I mean, obviously supply is still a huge issue.
Yeah.
Are you getting less than you thought you would from the federal government at this point?
So every single week, supply is the big question. And we find out 1 week ahead what we're getting for this week. So I can tell you the current week that we are in, we did not see a big increase of vaccine. Just to put a little bit of finer point on that, our Pfizer vaccine, which is the vaccine that we use with our hospitals at most of our the events that the city of Chicago is sponsoring, we saw 1 box increase, which means we got about 1,100 more doses to stretch across the entire city for the entire week. We did not see any increase in our Moderna doses, which is what we usually use for a lot of our outpatient providers, and we got about 3,100 doses of the Johnson & Johnson vaccine, which is still not a lot of vaccine. Late last week was when the FDA was reviewing the larger sites that are making taking the mass amounts of the Johnson & Johnson vaccine. We're hearing that went well. We haven't gotten the official numbers yet, but I continue to anticipate that in April and May we will see a lot more vaccine. And that's why next Monday is the date that we've really chosen to that expansion to 1C. Everybody's not going to be able to get a vaccine right at the beginning there, but we do feel confident based on everything we're hearing that that's going to ramp up, probably especially Johnson & Johnson in April and May.
And then Mayor, can you just comment on the latest from Loretto Hospital about this high-end watch store on Oak Street that was getting people vaccinated from Loretto?
Look, I fear that we're going to hear more stories, which is why we push pause on giving Loretto new first doses. The Department of Public Health, also myself personally, have been in contact with the CEO, the members of the board. They've got work to do, I think, to rebuild trust in their own community. We've reassured folks on the west side that we're never going to leave them in the lurch, and we're not. We have already put plans together for other providers to kind of take up the work that Loretto was doing, but clearly they've got to have better systems in place, better controls. They've got to have better data infrastructure to make sure that they can track people who they're supposed to be serving. So there's a lot of work that needs to be done. I don't expect them to be coming back online anytime soon, but we are there to support them as they identify issues in their systems and controls. But it's unfortunate that it's come to this.
All right, thank you, everybody.
Did you have a question back there?
Actually, I did. About the confusion with the dosing and places like Walgreens and ZocDoc and people booking appointments and having those appointments then canceled. Are you concerned that there is a lot of confusion in the city about how to get your dose, where to get your dose, who to get it from?
Well, look, when you've got a lot of different potential points of getting the vaccine, of course. So we focus and talk about ways in which we can really accelerate communication in the simplest ways possible. It's not perfect. It's probably never going to be perfect, but I can assure you that we're working very hard to make sure that we're communicating as effectively as we can, particularly when there's any kind of change. That's why we've done a lot of work over the last 4 days, for example, on the west side. There were a lot of questions when we said we're going to pause giving Loretto first doses, a lot of concern. So both Dr. Arwady, members of the CDPH team, me personally, we've been convening, working with community leaders. I did a bunch of church services yesterday to make sure that we are getting the message out in as clear a way as possible. And we need the feedback too if there is confusion so that we can clarify it for everyone. Look, the bottom line is there's not enough vaccine. We all know that. And we would love to be flooding neighborhoods like back of the yards with thousands of doses, but we're understanding that there is a finite amount of vaccine. We're trying to do this the fairest way, which is using the data and the science to tell us where the greatest need is, partnering up with organizations like U of I Health, Miles Square, and then going deep into these neighborhoods through our Protect Chicago Plus program. We will continue to do that, and hopefully we will see a exponential increase in the amount of vaccine that we get in April and May. That is our hope. That's what we've been repeatedly told from the Biden administration, and I hope that those words bear fruit and we see it in the amount of doses that we're getting on a weekly basis. Thank you all.
Thanks, everybody.